All right, let's dive in today into something that's, I think, super important for anybody going into nursing, and that is loss and grief and end-of-life care.
Yeah.
It's a tough subject, but it's so important. And, we're going to be looking at some materials here that I think can really help folks who are just starting to learn about this.
Absolutely. And it's really about providing that comfort and understanding during really vulnerable times in people's lives.
Yeah, I mean, that's what it comes down to, right? And one of the things that struck me as I was going through this material was how they really highlight all the different types of loss that someone can experience.
Mm-hmm.
It's not always like a physical loss, right? Like you think about someone who maybe has had an amputation or something.
Right.
But then there's this whole other concept of perceived loss.
That's a really good point because it's not tangible to others, but it's very real to the person experiencing it, like a loss of independence.
Yeah.
Maybe as their health declines or, the loss of a dream or something like that for their future.
Yeah. And I think for us as nurses, recognizing both of those actual and those perceived losses really helps us figure out how we're going to tailor our care.
Exactly.
It's about seeing that whole picture for that person.
And how their experience is unique, and so our interventions need to reflect that as well.
Absolutely.
Right.
So then we get into this really interesting part, which is how death itself is defined. And it's not as straightforward as it used to be.
Right. You're absolutely right, because it used to be just the heartbeat and the breathing stopping.
Yeah.
But now, medicine has advanced.
Yeah.
So it's much more nuanced.
So they talk about this legal shift that happened with the Uniform Determination of Death Act.
Right.
What's that all about?
Well, that was from 1981, and that added an irreversible cessation of all brain function as a way to define death.
So even if the heart is beating
exactly
because of life support,
yeah,
there's no brain activity.
Right.
They're considered legally dead.
Wow.
I can see how that could be really hard for families to wrap their heads around.
It is.
Looks like the very concept of life has gotten more complex.
It has. Imagine having to have that conversation with a family member.
Oh my gosh.
That, they witnessed their loved one being resuscitated and the heartbeat's there, but the person they knew is gone.
Yeah.
So clear communication and sensitivity is really essential for us.
Oh, absolutely.
Yeah.
So let's talk about some of the signs that death is approaching that nurses need to be aware of.
Well, the material points to a lot of different clinical signs that, some are more obvious than others.
Okay.
But like difficulty talking or swallowing.
Yeah.
Changes in their bathroom habits.
Okay.
And then the irregular heartbeat, breathing patterns.
Right. I remember learning about Cheyne-Stokes respirations.
Yes.
Like, that one always kind of stuck with me.
It's very distinct, and it can be an indicator that the body is starting to shut down.
Yeah, but recognizing those signs, it's so much more than just, checking off boxes.
Absolutely. You're anticipating their needs and providing comfort in those final moments.
Absolutely.
Yeah.
And I think that's where our skills as nurses become so important.
Exactly. And part of that is understanding the emotional and psychological journey that somebody might be going through. And, and I think we've all heard of the Kübler-Ross stages of dying, the denial, anger, bargaining.
Yeah, are they always in that order, though?
Well, and that's the thing, is that these stages aren't a strict roadmap.
Right.
Someone might not experience all of them. They might jump around, get stuck in one.
It's such a good point because we can't assume anything of how someone's going to process this.
Exactly. The material actually shares a really good anecdote about this terminal ill patient who was in complete denial.
Okay.
And was planning a big trip with family, convinced he was going to recover.
Wow.
So it makes you think, like, how do you balance respecting that hope?
Yeah.
But also preparing the family for what might come.
That's a tough situation to be in.
It is, but it comes back to that patient-centered approach.
Absolutely.
Yeah.
So that kind of leads us into this idea of the dying person's Bill of Rights.
Yes.
Which is all about advocating for the patient to have autonomy. Even in those final days.
It outlines the rights like being treated with dignity, being able to express their feelings and fears.
Yeah.
And being involved in the decisions.
It's like we become their voice when they can't speak for themselves.
Exactly.
And that brings us to this whole other important aspect of care, which is the advanced care planning.
Right. And that's something that everybody should consider. Yeah. Regardless of their age.
Doesn't matter how old you are.
Or health status.
Right.
Is having those tough conversations early on and figuring out what you would want if you couldn't speak for yourself.
And we, as nurses, can really help facilitate those conversations.
Exactly.
And guide people through it.
Absolutely.
So when we're talking about advanced care planning, Are there actual tools that go along with that?
Yeah, they talk about the advanced directives.
Okay.
And those are the legal documents like the living will, durable power of attorney for healthcare,
Right.
where they spell out their wishes.
Yeah, it gives people so much peace of mind to know that those things are in place.
And, it's interesting because there's actually a law, the Patient Self-Determination Act of 1990.
Oh, wow.
That requires hospitals to inform patients about these options.
So it's not just a good idea.
No.
It's actually mandated.
Right.
That really shows you how important this stuff is.
Absolutely.
And not just for the patient.
Right.
But for their loved ones, too.
And it takes a lot of burden off the families.
Yeah.
Knowing those wishes are documented.
But even with all that planning,
right,
there's still ethical and legal things to think about.
Absolutely.
Right? Like DNR orders and decisions about, life-sustaining treatments.
Right. It can get really complicated.
Yeah. And the materials mention this thing called VSED.
Yes.
Which is voluntary stopping of eating and drinking. So that's where a patient actually makes the choice. To refuse food and fluids, to hasten death.
Exactly.
So that's different than just not having an appetite.
It is.
Because you're getting closer to death.
It's a very complex choice, and it brings up all those ethical considerations.
And then you have things like assisted suicide.
Right.
And medically assisted dying.
Right.
Which are always, topics that bring up a lot of different opinions.
Absolutely. And the legality of those varies.
Right.
Depending on where you are.
Yeah. So how do we as nurses handle those situations where maybe a patient brings that up?
Well, you have to be prepared to have those conversations.
Yeah.
Approach them with compassion and respect.
Yeah.
And remember that even when a cure isn't possible,
right,
there's still so much we can do.
Absolutely.
For comfort and support.
And it's not just the patient who needs that support.
Right.
It's their family members and caregivers as well.
You're absolutely right. It's crucial to remember that our care extends beyond the patient.
Yeah.
We're there to support that entire family unit.
They talk about how families of terminally ill children often have a lot of guilt.
They do.
It's just heartbreaking to think about.
It is. They wonder if they somehow contributed to their child's condition.
Oh, gosh, that must be so hard.
And that's where our role as a compassionate caregiver becomes so vital.
It's not just about the medical stuff. It's about being there emotionally for those people.
Absolutely.
And being present.
Right. And we have to remember that those dealing with sudden death might have an even more difficult time.
Yeah, they haven't had as much time to prepare.
Because there's less time to process and make those really tough decisions.
It's different for everyone.
It is.
And grief doesn't have a timeline.
And let's not forget about ourselves.
Oh, that's so important.
We as nurses, we're not immune to the emotional toll of caring for dying patients. We need to make sure we're taking care of our own mental and emotional well-being.
Self-care is not a luxury.
It's not. It's a necessity.
It really is. So think about this as you move forward, in your nursing journey.
Okay.
How would you approach a family who's grappling with the loss of a child?
That's a great question.
What resources could you offer?
That's something to really reflect on.
Yeah. And we'll be back to talk a little bit more about how we can provide really excellent care at the end of life.
Right.
In part 2.
Absolutely. Welcome back. It's great to continue this conversation. And before the break, we were talking about the impact of loss on families and how far-reaching it can be.
Right. It's not just about the emotional part of it. Like, the materials go into some of the practical challenges.
Oh, absolutely. Like the loss of a primary provider can create a huge financial burden for families.
Especially like older adults who maybe lose a big chunk of their income.
Especially if that was part of their retirement income.
Yeah, and it's like this ripple effect.
Yeah.
That can touch every part of their life.
Absolutely.
Like they might even have to move.
Yeah.
And then they lose their community and support system.
Exactly.
On top of the grief.
And then we can't forget that cultural and spiritual beliefs play a role too.
That's so true. Because some cultures have very specific mourning rituals.
Right.
And different expectations for men and women during the grieving process.
Exactly.
Right.
And faith can be a source of comfort for some,
right,
while others might question their beliefs.
Yeah.
So it's really a multifaceted experience.
It really shows how important it is for us as nurses to be aware of all that.
Absolutely.
Those individual and cultural differences.
Yeah.
We can't just take a one-size-fits-all approach.
And speaking of the complexities of grief, the material talks about the impact on us.
Right, because we're not robots.
No.
We're human beings too.
Exactly. Yeah. We're affected by what we see and experience.
It's easy to forget that.
It is.
Because you're so focused on caring for other people.
Yeah, but witnessing death
Yeah.
and supporting grieving families takes a toll.
It does.
We need to acknowledge those feelings.
Right.
And develop coping skills.
It's not selfish to take care of ourselves.
Absolutely not.
It's actually essential.
It is.
If we want to be able to keep doing this.
Absolutely. Well said. And that leads us to how we can best provide that care.
Yeah.
And the nursing process.
Right.
That framework we learn early on is a really valuable guide here.
So how does that apply to end-of-life care?
Well, they stress the importance of thorough assessments.
Okay.
And not just physical assessments. You really have to delve into their understanding.
Of what's happening.
Their perceptions, their coping strategies, their resources.
It's about gathering all that information to make a plan.
Exactly.
That's truly individualized.
A truly individualized care plan that goes beyond just managing the physical symptoms.
So those assessments might reveal things like despair.
Yes.
Or dysfunctional grief.
Fear.
Fear.
Yeah. Hopelessness.
Right. And those are all normal responses to loss.
They're valid responses.
We need to address them.
We do. And it's not just about giving medications.
Right.
It's using a range of interventions.
Pharmacological and non-pharmacological.
Exactly. And when it comes to communication, sometimes the most powerful thing we can do is listen.
Yeah, I love that.
And the material highlights the importance of being comfortable with silence.
Sometimes words just aren't enough.
They're not. It's about creating a space for them to process and share what they need to share.
Absolutely. And when we do speak, the materials talk about being open and honest.
Absolutely.
Like acknowledging the patient's fears.
Right.
But without giving them false hope.
Exactly. It's being truthful while also being supportive.
Yeah. What about those tough conversations?
Yes.
Like when we have to make decisions about end-of-life care.
Clear communication is key.
Yeah.
And a shared decision-making process.
Oh,
the patient, the family, the healthcare team.
Right. Everybody's on the same page.
On the same page.
Okay. What happens when there's a conflict?
Right. Well, they suggest things like an ethics consult team or an ethics committee.
Okay.
They can help facilitate those conversations.
Yeah. It's good to know those resources are there.
Absolutely.
One thing that stood out to me was how much they emphasized respecting cultural and spiritual beliefs.
Oh, that's so important.
When providing care.
We need to approach each patient and family with sensitivity.
Recognizing that their background might be different from ours.
Yes, and they even mentioned some cultures have rituals for preparing the body after death.
And they said families should be allowed to participate in those.
Absolutely.
If that's what they want.
If they wish.
So to kind of recap what we've talked about so far.
Okay.
Providing quality end-of-life care is complex.
It is.
It's not easy.
It requires knowledge, compassion, and putting the patient at the center.
And we can't forget about self-care.
Absolutely.
We have to take care of ourselves too.
We do. So is there anything that's resonating with you?
Oh gosh, so much.
As particularly relevant.
Yeah, like what keeps coming back to me is that even when we can't cure someone, there's still so much we can do.
Absolutely.
Like we can provide comfort,
support,
help
patients find peace and meaning.
Yeah. It's about enabling hope.
It is a beautiful way to put it.
Even when things are really tough.
It is. And it's a reminder that we can have a positive impact on their lives.
Even in the most challenging situations.
Absolutely.
They even talk about helping patients achieve small goals.
Right.
Or fulfill last wishes.
Maybe seeing a grandchild one last time.
Yeah.
Or finishing a project.
Exactly.
Those small victories can bring so much joy.
Yeah, it shows how important it is to really be present with your patients.
Offering empathy.
Yeah. And helping them find those moments of peace and joy, even when they're suffering.
Well said. Yeah. And connecting that back to patient-centered care. It's about honoring their preferences and helping them live their final days with dignity and purpose.
And that leads us to holistic care.
Yes.
Which they talk about a little bit more.
Right. So let's explore that when we come back for part 3. We'll talk about specific nursing interventions and approaches.
All right. So we're back and ready to wrap up our deep dive on loss, grief, and end-of-life care. And when we left off, we were talking about that concept of holistic care.
Right. And it can feel kind of big, but it really comes down to, addressing the whole person, not just their physical symptoms. So the materials break it down into 3 main areas: physiological needs, psychological needs, and spiritual needs. And they're all connected.
Okay, so let's start with physiological needs. What are some of the things that nurses really need to focus on in that area?
Well, I think it goes back to the basics of nursing care.
Okay.
But with, a stronger focus on comfort and preserving dignity.
Yeah.
So, really paying attention to hygiene, managing pain, making sure they have enough to eat and drink,
Right.
helping them move around and go to the bathroom and taking care of their breathing.
I would imagine that pain management is especially important.
Absolutely.
For someone who's dying.
It really is. And the materials talk about how the patient's wishes have to come first.
Okay.
When it comes to pain relief.
Yeah.
Some people might want to control their own medication, while others might need more help. So it's finding that right balance between giving them enough pain relief, but also, respecting their choices.
And what about food and fluids?
Yeah, that's a tricky one.
Yeah, no, that can be hard to figure out.
It can. And the materials actually talk about foregoing artificial nutrition and hydration.
Wow.
Because sometimes those things can actually cause more problems than they help.
Oh, gosh, I bet that's a hard decision for families.
It is. And as nurses, we can help them understand all the different options.
Right.
But ultimately, the decision should be based on what the patient wants and what's best for them.
Absolutely. Okay, so we've talked about the physical needs.
Right.
What about the psychological stuff?
Right. Well, it's important to recognize that anyone who's dying is going to have all kinds of emotions.
Yeah.
Fear, anxiety, sadness, anger, even regret.
Yeah.
And it's our job to make sure they feel safe.
Right.
To express those feelings.
Without being judged.
Exactly. So just listening, offering reassurance, holding their hand or even sitting with them quietly can make a huge difference.
And they talk about some specific fears that people might have.
Yes, like being afraid of pain.
Yeah.
Or dying alone.
Right.
Or what's going to happen to their loved ones after they're gone.
Those are heavy things to be dealing with.
They are, and we can't take those fears away.
Right.
But we can at least be honest and open when we talk to them about it.
And then there's that spiritual piece.
Right, and that's different for everyone. Yeah. For some people, it's about their religion. For others, it's about finding meaning in nature or art or their relationships.
So it's about meeting the patient where they are.
Exactly. And even if their beliefs are different from ours, we have to respect that.
Absolutely.
So we can help them in different ways, like getting them access to religious services, or giving them privacy for prayer or meditation.
Or just listening to them talk about their spirituality.
Exactly.
All this makes me think about how important it is for nurses to be able to talk about death.
Yeah.
And I think for a lot of people, that's really hard.
It is, even for healthcare professionals.
Right, because we're not supposed to be afraid of those things.
But we're human.
Yeah.
And so as nurses, though, we have to provide sensitive care.
Right.
And that means having those tough conversations.
So what advice would you give to nurses who are struggling with that?
Well, the materials say it's good to think about your own beliefs about death.
Okay.
And, admit that you're uncomfortable talking about it.
Right.
And maybe even talk to other nurses about it.
It's okay to ask for help.
It is. We're not alone.
Right. And continuing education can be really helpful, too.
Absolutely.
To really dive deeper into this stuff.
There are so many resources out there for nurses.
Yeah, so we've learned a lot today.
We have.
What are some of the key takeaways that you would want listeners to remember?
Well, I think the most important thing is that good end-of-life care is about more than just medicine.
Okay.
It's about treating each person as an individual.
Yeah.
Understanding what they need and what they want and making sure they feel comfortable and respected.
And we can't forget about their families.
Right. We're there to help them through a really tough time.
It really is a privilege to do this work.
It is.
As we wrap up, I want to leave our listeners with one last thought.
Okay.
How do you think your own personal beliefs might affect the care that you provide?
That's a great question to think about. How do we handle those situations where our beliefs are different from the patients or their families?
Yeah, and how do we make sure that we're still giving the best care possible?
It's something we all have to think about.
And if you want to learn more about that, I highly recommend checking out the ANA Code of Ethics.
That's a great resource.
Yeah.
And don't forget about hospice and palliative care organizations.
They're a fantastic resource for everyone.
They are.
Well, this has been a really insightful deep dive.
It has.
Thanks for joining us.